Hello, my name is Danielle Louder, and I am Director of the Northeast Telehealth Resource Center, serving New England, New York, and New Jersey, and co-director of the MCD Public Health, a member of the National Network of Public Health Institutes. Our colleagues at the National Telehealth Technology Assessment Center, or TTAC, have invited me to chat with you today regarding the use of telehealth within the public health landscape. As we know, public health is a broad science focused on protecting and improving the health of people and communities through a wide variety of interventions, including health promotion, disease and injury prevention, and detection, prevention, and response to infectious diseases. Because of its potential to improve access to healthcare and resources, decrease costs, and enhance satisfaction among patients, families, and providers, telehealth is a very promising tool for public health in general. While telehealth technology has not yet been leveraged to its full potential, there are a growing number of use cases among various public health fields, such as emergency response, public health nursing, occupational health and safety, health education, nutrition, research, social work, epidemiology, and others. While we can't cover all of the great applications for telehealth here today, I hope that a few examples will entice you to learn more and think about how your organization or community might leverage technology to positively impact public health. We work with a broad variety of public health professionals to plan and implement telehealth programs such as emergency responders, public health physicians and nurses, nutrition experts, social workers, and many others. In many cases, we work with programs within state and county departments of public health. For example, we recently began working with Tufts University in Boston and other partners to provide technical assistance and resources to state and county WIC programs throughout the country that are looking to use telehealth to increase access to nutrition, education, and services. Disaster response and relief are also a great public health telehealth use case. Public health departments, hospitals, emergency responders, law enforcement, and other key partners can use telehealth to help bring virtual teams of expertise to the field to promote rapid and appropriate diagnosis, treatment, and triage. It can also help protect healthcare workers and prevent spread of disease by allowing remote interviewing, examination, and monitoring of patients. Mobile clinics with synchronous and asynchronous telehealth capacity provide access to health screenings and services in rural and underserved areas and for a wide variety of populations, including farmers, migrant workers, and others. Mhealth applications, such as secure texting, are helping pregnant women and moms access needed services. For example, telelactation, appointment reminders, and decision prompts, as well as education and resources to establish and maintain healthy habits. Similarly, Mhealth models are being utilized to help individuals with components of substance use and mental and behavioral health disorders. Project ECHO is another area that we're seeing strong interest and increased utilization among public health programs and practitioners. Using simple video conferencing technology, Project ECHO connects field experts with many providers at once, with the goal to expand knowledge and promote more rapid implementation of evidence-based practice among those serving rural and underserved populations. This case-based learning model promotes improved quality of care for common yet complex health issues, decreases isolation among rural providers, and allows them to incorporate new knowledge and skill sets across an entire population versus one patient or person at a time. Some great examples of Project ECHO programs within the public health landscape include, but are not limited to, overdose mapping, tick-borne diseases, cardiovascular health, older adult care, and suicide prevention. The TRCs are currently working with a number of Project ECHO programs across the country, and we provide a variety of assistance, including technology assessment, setup and troubleshooting for participating sites, training on ECHO methodology, and serving as ECHO faculty. As with medical and behavioral health applications, there are a number of important considerations when planning to use telehealth for public health practice. While we don't have time to dig into them all here today, I'll share a few of the biggies. You need to research state and federal policy related to telehealth in your specific use case. For example, some states will reimburse for live video consults, but do not cover store and forward applications like teledermatology. You must assess and choose the right technology solution for your use case. Keeping it as simple and user-friendly as possible and not breaking the budget are all good rules of thumb. Ensuring that the technology meets security and privacy requirements is a must. For example, is it HIPAA and/or FERPA compliant? And will the technology vendor sign a business associates agreement with your organization? Adequate training of your team to use the technology appropriately and effectively is another vital component. This includes connecting and troubleshooting, adapting your workflow, and ensuring security and privacy practices. You need to assess and address the needs of end users. For example, if your program includes participants receiving services at home, do they have internet connectivity? And if so, is it enough bandwidth to use the telehealth application? And will use of the program impact their monthly text and data charges? For in-depth technology info and expertise, the National Telehealth Technology Assessment Center, or TTAC, is your go-to resource. TTAC publishes toolkits, planning, purchasing, and deployment guides for a wide variety of telehealth technologies. You can find these toolkits on the TTAC website at www.telehealthtechnology.org. This one-stop shop provides a wealth of unbiased information that is useful to your whole team, including admin and operations, providers and practitioners in information technology, for a broad variety of telehealth-related information and resources, including policy, workflows, and protocols, strategic planning, technology, and more. Your regional telehealth resource centers are here to help. Please don't hesitate to reach out to us with questions or if you need technical assistance with starting or expanding your telehealth program. You can find your regional TRC as well as the experts at TTAC by accessing the National Consortium of Telehealth Resource Center website at www.telehealthresourcecenter.org. Thanks, and we look forward to hearing from you.